Oklahoma Blue Cross and Blue Shield is suing some drug rehabilitation centers in California and, well, it's primarily in California for what's basically insurance fraud. They're saying that these companies in California sent folks to Oklahoma to recruit folks that were on the street and whatnot, had them lie and claim they were making more money so they wouldn't be on the Medicare or Medicaid insurance and would be on the Blue Cross Blue Shield insurance, which was kind of a really nice had really nice benefits when it came to rehabilitating yourself from drugs. Now, they're suing and saying that this was all illegal and that they caused millions of dollars in payments. Well, this is going to be a fascinating lawsuit to follow because, well, it strikes at the heart of two industries. Insurance, which most people don't think actually is willing to pay for folks. Matter of fact, I know of of an insurance company that is raising the amount of denials that they do because they don't think that they look like they're a professionally ran insurance company unless they have a certain percentage of denials. While at the same time, these drug rehabilitation centers, a lot of them come across as shady folks that are doing more in the way of skimming money than they are of actually getting people off of drugs. Way too often you hear of these folks that are needing to clean themselves up, try to go to some of these centers and end up not being able to get off of it. So it makes you wonder how effective they are. But hey, I thought I'd bring this to you. Hit like and subscribe and let's talk about this for a minute.
Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself.
Now, I'm going to link the full article in the description down below, but this is coming from Oklahoma Watch. They're a little bit of a left wing organization, but they do some good research and they do some good work. Recruiters approached people struggling with addiction on the streets throughout Oklahoma and offered a lifeline, treatment and housing in beautiful Southern California for free. The recruiters knew that a drug treatment facility with the right insurance policy, they were worth tens of thousands of dollars. If you want to change your life around, and even if you just want a free ride vacation to California for 3 months or whatever, here it is, one recruiter told Derek Dunn in 2022. Dunn took the bait. So did more than 880 other Oklahomans lured to drug treatment facilities in California and Arizona between 2020 and 2025. Insurance company Blue Cross Blue Shield of Oklahoma alleged in two federal lawsuits. The company said that the scheme cost them $46 million in wrongful payments. Across the regions, patients observed that treatment facilities seemed to target Oklahomans. Russell Andrews attended South Coast Behavioral Health, a facility named in Blue Cross Blue Shield lawsuit in 2022. They had a running joke about calling it the Oklahomie because it was like 90% of us were from Oklahoma, Andrews said. Oklahoma Watch spoke to 9 former patients who collectively attended at least 12 facilities in Southern California. All but one said a majority of their fellow patients were Oklahomans. Recruiters set them up with insurance an insurance agent and coached them to lie about their income, so it appeared they made too much to qualify for Sooner Care, Oklahoma's Medicaid program, the insurance alleged. Instead, the false amount was just enough that the patient could qualify for a Blue Cross and Blue Shield of Oklahoma policy purchased through the individual marketplace. That policy, the recruiters knew, paid robust rates for out of state treatment according to the complaint. Once they were insured, recruiters bought plane tickets for their patients and told them their new insurance policy would cover the flights, housing, and inpatient and outpatient treatment, the complaint alleged. When a recruiter successfully delivered a new patient to a treatment facility, they got paid according to the petition. Blue Cross and Blue Shield of Oklahoma declined to comment for this story. South Coast Behavioral, a treatment provider named in the lawsuit, also declined to comment. In their answers, Asana Recovery and Beachfront Sober Living said the allegations are an attempt by Blue Cross and Blue Shield of Oklahoma to discourage out-of-state providers from treating Oklahoma residents in the need of substance use treatment. So there's more to this story, but you're getting an idea of what the complexities of this is. So it could be that this was insurance fraud. It could be that Oklahoma doesn't have enough drug treatment facilities or high quality enough facilities. But at the same time, some of these folks are sounding like, yeah, it was more of a scheme to get folks out of Oklahoma where the insurance policies were a little bit more lax about this. A little bit later in the article, it does talk about how some of this was not the best treatments and whatnot, but I'll let you read that. A lot of this has to do with the simple fact of that the folks that are treating people for drug addiction and alcohol addiction, normally turn out to be addicted to money. Now, I'm not saying that these folks in California and Arizona necessarily are, but that's the way it comes across to a lot of folks that are paying attention to this. While they're treating all these addictions, well, they're getting addicted to the money and the power that they're getting out of all of it. Now, the insurance companies at the same time ain't exactly got the best reputation when it comes to how they handle people's treatment on anything. They're too busy trying to turn folks down for treatment instead of actually allowing people the chance to get better. So it's not like I'm siding with Oklahoma Blue Cross and Blue Shield, but at the same time, it's drug facilities. And here's the reason why I'm taking a look, or that I got interested in this. You take a look at our justice system today. How many times do you have folks getting sent to drug treatment facilities because by the courts? Think about that. Judge ordered drug treatment facility. Supposedly the judges ain't making a dime off of it, but how many times has it been found out the judge is making money off of it? Or you take a look at these diversion programs that these folks get offered. Hey, you do this before you go to court, it'll help you get better. How many of those diversion programs that are sending folks to drug treatment facilities have a financial incentive to name certain facilities? You take a look at the money and the greed that's involved in this industry. Now, even as a laissez faire capitalist, I am well aware of the fact that once somebody gets greed in their system, that they're constantly looking for ways to do shortcuts and whatnot so they can make more money. Well aware of that. I'm also well aware of the fact that yes, there are valid drug treatment centers around the nation. But for folks that get addicted to this stuff, whether they want to or not, how do they pick this? This is a complicated issue, and I think people need to think about it because you have a lot of idiots that think, oh, well, I ain't ever been addicted to drugs. Well, you take a look at the good or good folks, and there have been plenty of good folks that got addicted to medication because of over prescriptions and whatnot, or prescriptions that just didn't, their body just took the drugs in a weird way, and they became addicted to drugs, and they honestly don't want to be, and so they go to these facilities. And well, if these facilities are not there to actually treat for drugs, but just to make money, well, good folks are losing money because of it, and they're losing their credibility because they can't, because of what addiction does to people. Some of it's you're weak in the mind. Some of it's actual physical addiction. And with drugs, a lot of times, except for marijuana, it really is about physical addiction. Marijuana is not a physical addiction. That's a mental thing right there. But we need to be aware of this because it's becoming a big deal in this country. It's been a big deal for a while. We need to take a look at the entire thing because it's turned into our tax dollars are getting wasted on it way too often. I thought I'd bring this to your attention. This has been Paul, the Redneck Thinker. Y'all have a good day now. Bye. So, folks, that's the story that I wanted to bring you on this video. And I just wanted to say thank you again for coming by. Hit like, subscribe, comment, all that fun stuff if you don't mind. Help me out. So, y'all have a good day now. Bye.